أعزائي طلبة المرحلة الأولى، السلام عليكم ورحمة الله وبركاته. Our lecture today is about the anatomy of the arm, or another name is the brachium. First, the arm is that part of the upper limb that extends in between the shoulder joint and the elbow joint. The bone of the arm is the humerus, which is the longest and largest bone of the upper limb. The humerus have expanded upper part, shaft, and lower part. The upper part or the proximal part or the proximal end have a hemispherical head surrounded by a constricted anatomical neck and have two tubercles. The anterior one is the lesser tubercle and the lateral one is the greater tubercle, or lesser tuberosity and the greater tuberosity. In between we have a groove called intertubercular groove. The part that unites the proximal end with the shaft is called the surgical neck. The distal end of the humerus have articular and non-articular parts. Articular part that share in the formation of the elbow joint, while the non-articular part doesn't share in the articulation. The articular part consists from the capitellum laterally and the trochlea medially. The non-articular part consists from the medial epicondyle and the lateral epicondyle and the three fossae: coronoid fossa, radial fossa, and posteriorly is the olecranon fossa. The nerve supply of the skin of the arm is by the following nerve. The first is the supraclavicular nerves. Supraclavicular nerves, these nerves supply the point of the shoulder to half way of the deltoid muscle. The upper lateral cutaneous nerve of the arm, which is a branch from the axillary nerve, supply the lower half of the skin over the deltoid muscle. Lower lateral cutaneous nerve of the arm supply the lower lateral aspect of the arm. The skin of the axilla or armpit and the medial side of the arm is supplied by the intercostobrachial nerve and the medial cutaneous nerve of the arm, while the posterior aspect of the arm is supplied by the posterior cutaneous nerve of the arm. So these are what we call the superficial nerves or the cutaneous nerves that are supplying the arm. In the superficial fascia, after removal of the skin, we will find the superficial veins of the arm. These are important veins. We have two major veins. The first one is the cephalic vein. The cephalic vein ascends in the superficial fascia on the lateral aspect or the lateral side of the biceps muscle. On reaching the infraclavicular fossa, it will drain into the axillary vein. On the medial side of the arm, we have the basilic vein. The basilic vein ascends in the superficial fascia on the medial side of the biceps muscle halfway, يعني منتصف المسافة, halfway up the arm. Medially, it pierces the deep fascia, and at the lower border of the teres major, it will join the brachial vein to form the axillary vein. So the superficial vein, we have two important veins. The lateral one is the cephalic vein and the medial one is the basilic vein. There are superficial limb vessels that it will accompany the superficial vein. those from the lateral side of the arm, it will follow the cephalic vein. Follow the cephalic vein to drain into the infraclavicular group of nodes. These are the infraclavicular group of lymph nodes lying in the deltopectoral triangle or the infraclavicular fossa. Those from the medial side of the arm, it will follow the basilic vein to the lateral group of axillary lymph node. We have another set of veins which are called deep veins. So, one that are superficial, subcephalic and the basilic, it run in the superficial fascia, and the deep veins, it will run deep to the deep fascia. These veins are called brachial vein, which one of the deep vein, it will accompany the brachial artery. It's called the vena comitans, so you can call it brachial vein, and it will continue. It will unite with the basilic vein, the lower border of teres major, to form the axillary vein. So these are the deep veins of the upper limb. Brachial vein, that will continue as the axillary vein. We have an important bony landmark in the distal end of the humerus that's called medial supracondylar ridge and the lateral supracondylar ridge. These are bony crests or ridge that extend from above the medial epicondyle and the lateral epicondyle respectively. These are called the medial supracondylar ridge and the lateral supracondylar ridge. To these ridges, we have the attachment of septum that is called intermuscular septum. These are thickening of deep fascia that attach to these supracondylar ridges. These septa, which is the medial intermuscular septum and the lateral intermuscular septum, will divide the arm into anterior compartment or flexor compartment and a posterior compartment or extensor compartment. Each compartment, it has its own nerve supply, blood supply, and its own function. يعني ليش راح يكون هذه المعزولات الانتيريور كومبارتمنت عن البوستيريور كومبارتمنت؟ لأنه كل كومبارتمنت الفانكشن مالته تختلف. النيرف سبلاي والبلد سبلاي is also different. مختلف. راح ناخذ أولا the anterior compartment or flexor compartment. What are the contents of the anterior facial compartment? So it contains muscle. These muscles are the biceps brachii, coracobrachialis, and brachialis. Blood supply is supplied by the brachial artery. Nerve supply to the muscle is the musculocutaneous nerve supplying these three muscles. And what are the structure passing through the compartment? Is the musculocutaneous, median, and ulnar nerve, brachial artery and the basilic vein. The radial nerve is present in the lower part of the anterior compartment. Here we can see this is the lateral intermuscular septum. This is the medial intermuscular septum separating the anterior compartment from the posterior compartment. Anterior compartment have this muscle with these nerves supplying them and the blood vessel passing through. These are the muscle. We have this is the biceps. It have long head and it have short head. The short head is originating from the coracoid process, and we have lower down we have the brachialis muscle. These are the three muscles forming the anterior compartment or the flexor compartment of the arm. This is the biceps taking origin from the short head from the coracoid process, long head from the supraglenoid tubercle, and the insertion to the bicipital tuberosity of the radius. This muscle regarded as a strong flexor and supinator to the forearm. Coracobrachialis originating from the coracoid process inserted to the humerus medially, and this is the brachialis originating from the shaft of the humerus and it is inserted to the coronoid process of the ulna. What is the blood supply of this compartment? Is through the brachial artery. Brachial artery is the continuation of the axillary artery. At the lower border of this muscle, teres major, the axillary artery will continue as the brachial artery. So it begins at the lower border of teres major muscle as a continuation of the axillary artery. It terminates opposite the neck of the radius by dividing into the radial and ulnar arteries. These are the terminal branches. We can see the relation of the median nerve to the brachial artery. First of all, the median nerve lies lateral, then anterior, then the median nerve will become medial at the lower part of the arm. The brachial artery have branches in the arm. These are muscular branches, muscular supplying the muscle, nutrient artery supplying the shaft of the humerus, profunda brachii artery. This is a large artery that spiral around the humerus in the spiral groove, supplying the posterior compartment, superior ulnar collateral artery, and inferior ulnar collateral artery. These two arteries share in the anastomosis around the elbow joint. And lastly, we have two terminal branches, the radial artery and the ulnar artery. This is the brachial artery dividing at the neck of the radius to two terminal branches, التفرعات النهائية للbrachial artery. So we have muscular branches, nutrient artery, profunda brachii artery, superior ulnar collateral, and the inferior ulnar collateral, radial and ulnar artery, which are the two terminal branches. The profunda brachii artery, it originates from the brachial artery from the beginning. As it begins at the lower border of teres major, the profunda brachii artery will originate from the brachial artery. We can see that the profunda brachii artery, superior ulnar collateral, inferior ulnar collateral artery will share in the anastomosis around elbow joint. anastomosis معناها شبكة من الشرايين راح تحيط المفصل. هذا هو رسم ثاني للanastomosis around the elbow joint. These are branches from the profunda brachii artery, superior and inferior ulnar collateral artery, profunda brachii artery, and the branches that is ascending from the radial and ulnar artery. What is the nerve supply of this compartment of these three muscles, اللي هي الcoracobrachialis, biceps and brachialis, is through the musculocutaneous nerve. Musculocutaneous nerve, this is the M shape of this collection of nerves. This is the lateral limb of the M. It passes through coracobrachialis, piercing this muscle to pass in between biceps and the brachialis. Then at the lower border, laterally to the biceps, it will become cutaneous branch of the lateral cutaneous branch of the forearm. So it is musculocutaneous because it supplies muscle, and then it will become cutaneous to the lateral aspect of the forearm. Here we can see how the musculocutaneous is passing through coracobrachialis, then supplying biceps and brachialis, and then it becomes the lateral cutaneous nerve of the forearm, or the lateral antebrachial cutaneous nerve. The median nerve, another content of this compartment is the median nerve. This is the median nerve. This is the middle of the M shape of this collection of nerve formed by the lateral root of the median and the medial root of the median. First of all, it is formed on the lateral aspect of the brachial artery. At the mid of the arm, it becomes anterior, and then more distally, it becomes medial to the brachial artery. The median nerve have no branches in the arm except to supply a vasomotor branch to the brachial artery. We can see here that this is the median nerve. First of all, it is lateral to the brachial artery. At the mid of the arm, it becomes medial, it becomes anterior, and lastly, distally, it becomes medial to the brachial artery. Another nerve in the anterior compartment is the ulnar nerve. Ulnar nerve, we can see here, this is the ulnar nerve. In the anterior compartment of the arm, lies medial to the brachial artery. At the mid of the arm, it pierces the medial intermuscular septum with the superior ulnar collateral artery to pass to the posterior compartment. يعني راح يعبر عندنا من ال anterior compartment راح يصير وين؟ ال posterior compartment. راح يعبر ويانا. هذا هو ال ulnar nerve. This is the M shape. هذا هو ال M shape. And the ulnar nerve is the medial limb of the M. هذا هو the ulnar nerve. At the mid of the arm, it will cross from the anterior compartment to pass to the posterior compartment. يعني راح يصير the posterior compartment accompanied with the superior ulnar collateral artery. لما عبر عندنا هنا بالposterior compartment, it will pass behind the medial epicondyle. Here, behind the medial epicondyle, this is the ulnar nerve, behind the medial epicondyle, to continue in the forearm between the two heads of this muscle. This is the ulnar nerve passing behind the medial epicondyle. Posterior compartment of the arm or the extensor compartment. Also, it contains muscle, nerves, blood vessels, and structure passing through. What are the content of the posterior facial compartment of the upper arm? المصل موجودة عندنا الترايسبس. Nerve supply to the muscle is the radial nerve, while blood supply is by profunda brachii and the ulnar collateral arteries. What are the structure passing through the posterior compartment is the radial nerve and the ulnar nerve. This is the triceps muscle. It's called triceps because it has three heads: the long head, the medial head, and the lateral head. The long head is taking origin from the infraglenoid tubercle of the scapula. The medial and the lateral head taking origin from the shaft of the humerus. It takes insertion to the olecranon process of ulna. The arrangement of this muscle يعني موجود عندنا التريز minor والتريز major والlong head of biceps with the shaft of the humerus. It will form spaces. This one called the quadriangular space, another one called the triangular spaces, one that is lateral and one that is medial space, triangular space. This space called triangular space bounded by teres major, long head of biceps, and the shaft of the humerus. Through these spaces there are certain nerve and blood vessel will pass. عندنا شرايين وأعصاب راح تمر من خلال هذه الفراغات. What is the blood supply of this compartment is through profunda brachii artery and the ulnar collateral arteries. مثل ما قلنا أنه profunda brachii artery, this is one of the branches of the brachial artery. At the beginning of the brachial artery pass to the posterior compartment in the spiral groove on the posterior aspect of the humerus accompanied with the radial nerve. Another arteries that supply the posterior compartment is the superior and inferior ulnar collateral arteries. This is the profunda brachii artery passing in the spiral groove to the posterior compartment. Also we have the superior ulnar collateral and the inferior ulnar collateral artery passing to the posterior compartment to supply the extensor compartment. What is the nerve of this compartment is the radial nerve. This is the radial nerve, regarded as the direct continuation of the posterior cord of the brachial plexus, passing in this triangular interval. Triangular interval is in between teres major above, long head of triceps, and the shaft of the humerus. It will pass to the posterior compartment. The radial nerve here accompanied with the profunda brachii artery. They pass in the spiral groove in direct contact with the bone, with the shaft of the humerus. This is the triangular, or we can call it lower triangular space bounded by teres major, long head of biceps with the shaft of the humerus. Here, this is the radial nerve with the profunda brachii artery in the spiral groove, and the radial nerve giving the branches to the muscle, and also it gave cutaneous branches. This is the radial nerve, also another figure passing in the posterior compartment, supplying the triceps muscle, and it's passing in the spiral groove. At the lower end of the arm, it will pass to the anterior compartment, and it will pass through the lateral intermuscular septum to become in the anterior compartment. So what are the branches of the radial nerve? In the axilla, it will give long branches to the long and medial head of the triceps, and it will give the posterior cutaneous nerve of the arm. In the spiral groove of the humerus, when it is accompanied with the profunda brachii artery, it will give branches to the lateral and medial heads of the triceps and to a muscle that is called anconeus. Also, it gives a cutaneous branch that is called lower lateral cutaneous nerve of the arm and the posterior cutaneous nerve of the forearm. Lastly, when it becomes in the anterior compartment of the arm, it will give branches to the brachialis, brachioradialis, and extensor carpi radialis longus, and also when it lies nearby to the elbow joint, it will give an articular branches to the elbow joint. So the branches of radial nerve, it will give branches in the axilla, branches in the spiral groove, and more distally when it become in the anterior compartment. يعني هو كان بالبداية بالposterior compartment. At the distal part of the arm, it will cross or pass through the lateral intermuscular septum to become in the anterior compartment, to give branches to the brachialis, brachioradialis, and extensor carpi radialis longus, and give also articular branches to the elbow joint. هذا هو this is the humerus, this is the spiral groove, and in the spiral groove passing in between the medial and the lateral head of the triceps. In this spiral groove, the profunda brachii and the radial nerve will pass in direct contact with the bone. Here we can see the radial nerve passing in the triangular interval or space, then in the spiral groove to become in the posterior compartment. At the distal end of the arm, it will pierce the lateral intermuscular septum to become in the anterior compartment. يعني بالبداية هو كان بالposterior compartment بالspiral groove. بالlower part of the arm, it will pass through the lateral intermuscular septum, يعني راح ينفذ من الحاجز البعيد to become in the anterior compartment. Here it will give a branches to the elbow joint, supply the elbow joint and supply muscle, which are brachioradialis, extensor carpi radialis, longus, and brachioradialis. These are cutaneous branches that are given from the radial nerve. يعني ينطينا مثلا lower lateral cutaneous nerve of the arm مثل ما قلنا، ينطينا posterior cutaneous nerve of the forearm. Also its superficial branch will supply part of the dorsum of the hand. فراح يكون بالمجموع ينطينا lower lateral cutaneous nerve of the arm, posterior cutaneous nerve of the arm, and posterior cutaneous nerve of the forearm. Thank you.